This is Mr. Simon, a 58-year-old male. He's a new patient to the clinic whose chief complaint today is chest pain when he's working outside or exercising. He's a little upset that he's seeing a nurse practitioner instead of a doctor. He just keeps saying, "I'll have to see a doctor anyway. Nurses can't tell me what's wrong or do anything to make me better."
Okay, thank you, Daniel. Looks like I'll need to spend a little time educating Mr. Simon on exactly what nurse practitioners can do. I'll let you know if we need any blood work or labs, okay?
Okay, don't forget.
Oh, thank you. Hi, Mr. Simon. My name is Stacy. I'm a nurse practitioner here at the clinic. It's really nice to meet you. Can you tell me what brings you in today?
I'm sure you're really nice and all, but I don't see the point of going over this with you. Everyone knows that nurses can't diagnose, can't order tests, can't prescribe meds, and can't refer to specialists. Can't I just talk to a doctor?
All right, stop. I collaborate with a physician, but the board of nursing says diagnosing is my business. Sometimes you grab your chest so tightly. Lucky for you, it's just daily, not nightly. Will it ever stop? Yo, I know. I'll order some tests, and they'll show to the EKG looking for ST elevation. Everything looks great. Need a new source of revelation. Blood, troponin, lipids, and bloom. Cholesterol's killing you like a poisonous mushroom, deadly. But treating you is my specialty. Anything less than the best is a felony. Inhale, now exhale. Your lungs sound great. Just breathe normal while I listen to your heart rate. If there is a problem, yo, I'll solve it. Check out these pills. Your chest pain, they'll resolve it. Diagnosing, baby. NPs are diagnosing, baby. So, Mr. Simon, as you can see, following a heart-healthy diet to lower your cholesterol isn't so bad. And I'd really prefer we try this before we add a cholesterol-lowering medication.
Yeah, I think you can do that.
Great. I'll call that nitroglycerin into your pharmacy to help with your chest pain. Can you remind me how you're going to take it?
I'll let one dissolve under my tongue when the pain starts. 2 more doses, 5 minutes apart.
But
I'll call 911 if the pain doesn't stop.
perfect. It sounds like you know exactly what to do.
Thanks to you, I've never had a doctor spend this much time with me telling me how to take care of myself.
Well, you know, multiple studies show that patients with health conditions like diabetes, high blood pressure, and high cholesterol have better health outcomes when their care is managed by a nurse practitioner. That's mostly because we spend a lot of time educating our patients.
I'd love for you to be my primary care provider.
I'd like that too. But from the thorough health history I gathered, it looks like you have a pretty significant family history of heart disease. So I'd like to also refer you to a cardiologist.
Nurse practitioners can make referrals too?
Do we need to sing the song again? Diagnosing, baby. NPs are diagnosing, baby.
So hopefully that was just a fun little video to help demonstrate all the things that nurse practitioners are capable of. The scope of practice for the nurse practitioner is determined by each state's Board of Nursing, and in Alabama, FNPs are licensed to treat patients of both sexes across the lifespan. The scope of practice of the NP includes assessment and physical examination, which was just very briefly shown in sort of a comical way in the video, ordering or performing and interpreting diagnostic tests, so it could be EKGs or blood work. Many other things are available. Diagnosing acute and chronic illnesses such as angina and hyperlipidemia. Development of individualized treatment plans. So for some patients that might be prescribing appropriate medications, or it might be using diet to avoid medications like we did in the video, but we also prescribe the appropriate medications, which in that case was nitroglycerin. Then also NPs are within their scope of practice to refer to specialists such as the cardiologist that we did in the video. Nurse practitioners as primary care providers. In the video, our patient so graciously chose to ask the nurse practitioner to be his primary care provider, which is something that he or she is absolutely capable of within their scope of practice. In many settings today, family and primary care nurse practitioners manage their own patient panel, and in some cases, depending on the state regulations, they can independently manage their own practices. As of 2016, 50% of all nurse practitioners were in primary care practice. So the video briefly touched on improved health outcomes. So multiple studies have shown that care provided by nurse practitioners has been shown to have positive outcomes on management of chronic diseases. And then conversely, areas and populations with lower percentage of care provided by NPs have the lowest diabetes and hypertension related health outcomes for their patients. Greater outcomes in chronic disease management can be directly attributed to superior patient education provided by NPs, and research has shown that NPs spend almost 25% of each visit on education with an emphasis on health promotion and disease prevention. And here are references for all the information that was provided in the video. Thank you so much for watching.